Hello friends, today we are going to discuss about specific learning disorder certification, that is disability certification of specific learning disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry working at Niman's Bangalore. In this video, I'll be discussing about SLD, disability certification of specific learning disorder, challenges in certifying SLD, and future directions. Specific learning disorder is an umbrella term for a group of neurodevelopmental disorders that are typically diagnosed in early school age children, although it may be recognized in the adulthood also. They are characterized by persistent impairment in at least one of the following: reading, writing expression, mathematics, or combination of above. SLD is a potentially disabling condition that interferes with adaptation at school and society. Specific learning disability, here the disability word comes in, for the purpose of providing legal support to the child so that the child has an equal opportunity to contribute within the society and also get welfare measures. As per the Right to Persons with Disability Act of 2016, specific learning disability has been defined like this. SLD means a heterogeneous group of conditions wherein there is a deficit in processing, language, spoken or written, that may manifest itself as a difficulty of comprehension, speech, read, writing, spelling, or to do mathematical calculation, and includes such conditions as perceptual disabilities, dyslexia, dysgraphia, dyscalculia, dyspraxia, and developmental aphasia. This is a very comprehensive definition. Of course, it is very confusing. However, specific learning disability is very specific. As per the ICD-11 and DSM-5, the three categories can be: disability assessment can be done and certificate can be given. They are dyslexia, dyscalculia, and dysgraphia. To do intervention, trained human resources, accommodation, and remedial measures are very essential. For this, there is a huge cost the society has to bear. The simple reason, the prevalence of SLD is around 8%. And imagine if we have to do the remedial measure for 2 to 3 crore children, the amount of human resources required for assessment and the remedial measures will be there for 1 to 3 years. Children with SLD who do not get any intervention will pay a huge price to the society, to the family, and to themselves. Let's understand about SLD certification here. As per the Right to Persons with Disability Act of 2016, it came into force on 19th April 2017. That means this law is in force now. Even the rules was notified in 2017, that is on 15th June 2017, rules were also notified. From 1st of June 2021, unique disability ID card also has been centralized. The server is there. One need to get any disability benefits and also social welfare benefits, one need to register in UDID. Let's look at the prevalence of specific learning disorder. The lifetime prevalence in US is around 9%, but however, as per American Psychiatric Association DSM-5, they say the prevalence varies somewhere between 5 to 15%, depending upon the scales you are using, depending upon the caseness, how you're going to define SLD, and also what is the standard deviation. Is it 1.4 or 1.5 or 2% are you considering? That means 2 standard deviation are you considering? There was a meta-analysis and systematic analysis was done in June 2022. These are the studies published in India. If you look at the results, it clearly says 8% of the children has SLD. These results came through meta-analysis of 6 studies comprising of 8,133 students or children. However, the analysis was limited in all these studies, hence subgroup analysis could not be done. Let's look into the evaluation and assessment of SLD. Usually, Parents bring the child for behavioral problems, emotional problems, substance use, school refusal, oppositional defiant disorder, conduct disorder, depression, anxiety, substance use, academic decline, or else the parents may bring the child telling that child is very stupid, trouble creator, lazy, procrastinator. Those are the things the parents do bring the child to the psychiatrist. And even the schools can refer for academic decline, difficulties, poor scoring, unable to write properly, not completing the homework, poor handwriting, not completing the writing task, spelling mistakes, reading slowly, laborious writing, reading word by word, reading without punctuations, mistakes in doing calculation, arithmetics. For those reasons, or if the child fails in the test repeatedly or in the final exam, the school may refer the child for assessment. Diagnosis of this SLD is done by a psychiatrist based on various information. First and the foremost is detailed clinical evaluation by the psychiatrist, observation by the psychiatrist, interview, family history, at the same time, school teachers report. Further, informal assessment. The psychiatrist can ask the parents to bring the child's notes, homework assignment book, maybe even class exam answer sheets. Based upon all these informal assessment, the psychiatrist can diagnose SLD without even assessment. However, one may take the help of neuropsychological testing based upon the severity, based upon if the child is not improving in spite of reasonable degree of remedial measures have been done. For purpose of disability certification, we need to do neuropsych assessment. Let's look at those psychometric and neuropsychiatric assessment. One need to do two important tests. One is cognitive abilities, another one is academic abilities. As per the SLD definition, there should be a discrepancy between the cognitive ability, that means intellectual ability, versus academic ability. What does it mean? Many times the parents will say, my child is very intelligent. He knows how to repair a TV, maybe mobile. He knows how to navigate. He is very smart. He is very popular among the kids in the locality, but has a very poor academic performance. That clearly indicates the child is bright but has academic difficulties. That means there is a specific learning disorder, not the global developmental problem like mental retardation or intellectual disability. Please do consider, I do apologize for using mental retardation because it's a very derogatory term, but during teaching, many of the old teachers or maybe the clinicians may not be able to understand the new term intellectual disability. One of the recent tool that has been used nowadays is specific learning disability or screening questionnaire. That can be utilized, but however, it has a limited role because it has not been completely validated across all the languages and culture. Let's look at the IQ assessment. You can use BKT, Balanced Intelligence Scales for children's IQ test, Wechsler's Intelligence Scale also can be used. With regard to SLD assessment, there are various battery. But for certification in India, as per RPWD Act, that is Right to Persons with Disability Act of 2016, Niman's index for SLD battery has to be utilized. There are various are there that is for assessment only, such as wide range achievement, test of written language, Wechsler's individual achievement test, Hoffman's test of education and achievement, Peabody individual achievement test revised, and Aston index battery. So there are various are there, but however, for the purpose of certification, Niman's battery has to be utilized. The Niman's battery has level 1 and level 2. Level 1 is for 5 to 7 years and level 2 is for 8 to 12 years. Level 1 talks about assessment of pre-academic skills, attention, visual and auditory, discrimination, visual and auditory memory, speech and language, visuomotor language, writing and number skills. That is at the level 1. Level 2, that is assess of the area of attention, reading, spelling, perceptio-motor, visuomotor integration, memory and arithmetic skills. This Niman's battery has to be administered by the clinical psychologist or the special educators. This SLD battery is used for SLD assessment to monitor the progress of the child after the remedial measures. Wide ranges of tests are covered in this, easily available, administered, good for early identification, and it is pen paper test. However, it has a limited range from 5 to 12 years, available in limited languages. It needs to be translated in various other languages and needs to be validated in that culture. However, with this background, we need to know what is the notification done by the government with regard to guidelines for disability evaluation and certification. This was notified by the Government of India on 4th January 2018. This is the guideline which is notified by the government. This is called as Guidelines for Evaluation and Procedure for Certification of Various Specific Disabilities or Specified Disabilities as per the RPWD Act. Here, this was, as notified earlier, it was initially, assessment was done by pediatrician. As you know, the pediatrician, the psychiatric posting, and that too specifically for child psychiatric posting, is very minimal. And for your knowledge, the child psychiatry is there hardly in 2-digit number only. That means we may have around 30 to 40 child guidance clinic across India. And how many of the pediatrician gets posted here? How many of them undergo at least for a period of 6 months of training here? And also, this clinical guidelines talked about severity. Unfortunately, Niman's battery does not give severity rating. Further, the medical authority for certifying was only pediatrician or pediatric neurologist. That means psychiatrist was not included. Whether it is a deliberate attempt or else an error, we do not know. Further, let's look into how the process is done as per the guideline. The teacher, when she notices the child is having academic decline, fall in school grade is seen, the teacher should administer SLD screening tool. Wow. SLD screening tool should be made available to the teacher, and teacher should be trained in administering SLD screening tool. Unfortunately, this screening tool is not yet notified and it is not available in many languages. Once the child has been assessed with the screening tool and it is positive, then the child will be referred to the school committee which is there in the school or to the principal of that school to bring to the notice. Now the principal and the school or the school committee will refer the child for the professional assessment. That is, based upon the screening result and the referral from the principal, it will be referred to the pediatrician or to the psychiatrist or to the pediatric neurologist. Invariably, it is best to be referred to the psychiatrist. The simple reason being is 70% of the comorbidities with SLD have psychiatric in origin. However, the child needs to be assessed not only by the psychiatrist or ENT specialist, ophthalmologist, by pediatrician to look whether the child has any physical problems. Hence, we need to search for comorbid condition and treat them before we do SLD assessment. Once you have done the all physical examination, ENT examination, ophthal examination, pediatric opinion, you need to do at least a remedial measure for 3 to 6 months at home and even if it's school. In spite of that, the child continues to have problems. That means it is not difficulties. We are dealing with the disorder. If the remedial measures improves the child performance, that means the child is having some SLD difficulties. That means there is a difficulty is there. It may be because of psychiatric reasons or neurological reason or physical reasons that have been removed and the child improves. That means the child does not have specific learning disorder and disability certificate cannot be done. Once, if the child has persistent difficulties in academics, then IQ assessment has to be done. Here, once you do the IQ assessment, and if the child has IQ more than 85, that means that doesn't fall under the mild MR, then only you know that this child does not have intellectual disability or mental retardation, that means it has specific learning disability. Hence, you'll be doing specific learning disorder assessment. Once it is done, you have to counsel the parents and SLD certification has to be done. That is, the board will certify the disability. Once it is done, invariably, the child needs to be assessed at the age of 6 to 7 years, first time, second time at the age of 14 years, and last at the age of 18 years. Niman's battery shall be applied for diagnostic test for SLD. That is very, very essential. What is the validity of this certificate? The certification will be done for children aged 8 years and above only. But however, that is for certification. With regard for the treatment purposes, to know where the child has difficulties, you can do the assessment at the age of 6 years, 5 years, so that the remedial measures can be taken early. Child will have to undergo a repeat test at the age of 14 and at the age of 18. The certificate which is issued at the age of 18 will be valid for lifelong. If the child gets the SLD certificate at the age of 14, that means, and if it does not get it at the 18 years, it is not lifelong. Here, the law is very clear, which has been notified. The certificate which is issued at the 18 years will be considered valid for lifelong. But however, on 9th of December 2020, because of various difficulties in the SLD assessment, there was an amendment by the Government of India with regard to SLD disability certification. This is the disability certification notification with regard to amendment that was published on 9th December 2020. Let's look into what are those changes. First and the foremost, along with the pediatrician for assessment, psychiatrist has been added. Not only that, Niman's battery will say whether the child has SLD or not. It does not specify the severity. Hence, there was an amendment in the guideline telling that if the child Niman's battery is positive, that means it has 40% disability. That is the way it is clearly mentioned. Here you will not be telling 70%, 80%. If the child is SLD positive, that is 2 standard deviation from the normal score, that means 40% disability. Further, for certification purpose, psychiatrist has been added. That means to some extent, they are able to remove the difficulties by this amendment. Let's look into the specific learning disability certification. Here, as per the rules which has been notified, one need to use form number 4 to apply. This is applied online, that is through internet. You need to go to swalambam.gov.in. Suppose if you are unable to remember this, go to the Google and type UDID, that is Unique Disability ID card or identity card. You will get swalambam.gov.in. Here, you need to fill the form 4 by giving proof of residence, that is Aadhaar card, and the Aadhaar card should be the persons with disability. Recent 2 passport size photographs need to be uploaded, and also Aadhaar enrollment number. Further, once this has been uploaded, the medical authority or any other certified competent authority, if they have given certain certification, that also can be uploaded so that the central server comes to know about all the requirement has been done. And within 1 month, there will be an appointment given depending upon the local or geographic your residence. The nearest medical authority will be notified that this person is got the appointment for certification. And here, the serial number 13 is a specific learning disability. You will be certifying here in this form. And also there are various forms which can be utilized during SLD certification. Form number 6, that is certificate of disability if the child has multiple disabilities. Imagine the child has specific learning disability and also another physical disability. Maybe the child also has locomotor disability. Then you will be using form number 6. Form number 7, certificate of disability. If other than 5 and 6 are you to utilize, you will be using form number 7. Form number 8 that is intimation of rejection, that the child does not qualify for disability, has to be intimated through form number 8. Let's look into the challenges in SLD certification. First and the foremost challenge is, does every school has SLD screening committee? Does all school teachers have been trained in screening for SLD? Do we have SLD screening instrument in all languages? Is it been validated? Has it been tested in various culture? Further, DSM-5 and ICD-11 clearly says it is a persistent disorder. That means a reasonable degree of remedial measures has to be taken at least for a period of 6 months to rule out between SLD difficulties, learning difficulties versus learning disorder. Are we doing this? Are we doing remedial measures before assessing the disability? Does government have notified an SLD screening instrument or else assessment scale? Although there is Niman's battery, but it is there up to 12 to 14 years. What about above 14 years? Do we have adequate number of clinical psychologists or special educator to assess this Niman's assessment battery for SLD assessment? What if the SLD assessment is not done at the age of 18 years or maybe not at the 14 years? If the child reports at the age of 19 or he is an adult, but he says, I have SLD problem, can we give? Or are we depriving by his rights? SLD assessment battery is not devised, as I mentioned, for 16 to 18 years. Does SLD screening instrument and Niman's SLD instrument is translated in various languages? Have we trained adequate number of human resources? So these are the important questions we need to answer. Not only that, we need to have adequate human resources to do remedial measures, that is treatment. Do we have those numbers? That is the biggest challenge. So what are the future directions for all the health professionals, psychiatrists, pediatrician, neurologist, health educators, teachers, parents? We need to train all the pediatricians. We need to train as many medical doctors. We need to train teachers, special educators. SLD screening instrument needs to be standardized. Teachers need to be trained in that. SLD Niman's assessment battery need to be standardized up to the age of 18 years. Translation need to be done in all languages and validated in the respective culture also. This is high time. We need to start MD in child psychiatry. We have MD in adult psychiatry. We need to start MD in child psychiatry. Simple reason is we have 40% of our population are children. That is more than 50 crore or below 18. And we have very few child psychiatrists across the country. Hence, we need to start MD in child psychiatry in similar lines of pediatrics. Although we have MD medicine, we also have MD pediatrics because we have a huge population. We need to manufacture SLD remedial human resources in thousands because we have to address this mammoth problem. We need to take the help of the digital technology for SLD remedial measures using metaverse, using virtual reality, augmented reality. We need to come up with these innovations so that the child can be trained. We need to implement national education policy in true spirit so that children with specific learning disorder can be accommodated and also modification can be done. To conclude, my dear friends, SLD is an umbrella term of group of neurodevelopmental disorder. SLD certification requires multiple sessions. Before certification, a reasonable degree of remedial measures to be undertaken at school and also at home. In spite of remedial measures over a period of 6 months, if there is no improvement, that means the child has a persistent academical problem. That means the child needs to undergo SLD assessment. All academic difficulties are not learning disorder, and that thus the child may not get learning disability certificate. Today, we need to innovate digital technology for SLD assessment and intervention. That means remedial measures to be done using technology to overcome the lack of human resource in our country. We have a big task. We have a huge responsibility as a human resources development and also to answer for young population for the future of our country. Thank you very much for your valuable time. Stay safe.